On today's episode of Invoke Insights, we hear from Matthew Gould, CEO of NHSX, former British ambassador to Israel, and previously Director General for Digital and Media Policy for the UK government. In conversation with Dr. Mike Lynch, OBE, Matthew discusses the digital transformation of the NHS, the dawn of personalised medicine, and the potential for AI and automation to transform healthcare.
So Matthew, thank you very much for taking the time to have a chat today. Must be said, you're probably one of the nearest things to a modern polymath I can imagine, in that you're the go-to man for recommendations on Persian meals and cybersecurity and technology in healthcare and a long list of other things that you've done in your career. So in 20 minutes, it's going to be quite difficult to get through all of those, so we may have to do Persian meals another time. But one thing I did want to ask you about, which is in the news today, is the, some might say, final arrival of the internet harms legislation and the idea that, you know, we are going to see some boundaries on what's acceptable in the social media and online world. And I know that's an area that you've done a lot of work in behind the scenes. So are you pleased with how it's all turned out?
Well, this isn't about my current job, but my previous job when I was Director General of Digital Policy at DCMS. And there I started an online harms and security team, and we came up with the plan and the framework, which is being announced today by the government. So, look, I think it's a serious, well thought through attempt by the government to do something which hasn't been done anywhere else in this form, which is to in the world, which is to tackle in a sort of comprehensive and systematic way the risks that online harms pose. I haven't been in DCMS for the best part of 2 years, so I'm a bit out of date in terms of what's happened since I left. But it's identifiably the same plan as I was working on when I was there, and it's nice to see it come to fruition. And obviously, a lot of thought has gone in the meantime to mitigating some of the risks and issues associated with what we were planning. So it leaves me optimistic.
No, I think it's a really interesting development, because obviously the reality is that this online world is so central to so many people's lives now that you're making a start in starting to put in a sophisticated and forward-looking framework does seem to be a good thing. So that was what you were doing then. Obviously now you've been spending a lot more time thinking about technology and healthcare. We've come through this sort of incredible year, which has really highlighted to people a whole series of things that they probably didn't think about every day. Things like bed capacity and how data is used and risk and things like that. Do you think the COVID experience is actually going to lead to an acceleration of technology into the health service?
I think it has already accelerated both digitization and attitudes. So at the start of the year, just to give you an interesting data point, about 3% of GP surgeries were enabled for doing online consultations. We think that's now above 99%. At the start of the year, almost every consultation across the health service was done face-to-face. A very high proportion of them are now done remotely. At the start of the year, very few people, particularly clinicians, were working from home or felt able to work from home. We've now shown that it is totally doable. Now, some of this is obviously a function of the particular pressures of the pandemic, but I don't think it'll go back to where it was before, because we've shown that certain things are possible that are actually rather helpful regardless of whether there is a pandemic or not. So it is much better for everyone if people don't need to keep going into their GP surgeries or hospitals for very routine conversations that could be done online or over the phone. So I think that will change. I think people, both staff in health and care and the public, have realized that healthcare can be delivered differently. And so it's opened the door and it's opened attitudes. And then for me, I think the most exciting thing of all is it's not just about, and it hasn't this year just been about doing the same thing but online, but actually we started with digitizing existing processes, but more and more we are looking at genuinely transforming services and healthcare using digital technology. So to give you an example, if you have hypertension, then unless you can afford your own blood pressure monitor, which quite a few people do, but by no means everyone, then if you want your blood pressure monitored, you have to schlep into your GP or hospital on a regular basis to see how your blood pressure is doing. Now, we are distributing tens of thousands of blood pressure monitors, all with a digital underpinning, so that people can monitor themselves, look after themselves at home. Their clinicians can see how they're doing. The quality of data and the frequency of data will be much higher. It saves a huge amount of patient time. It also saves a huge amount of clinician time, and it means that clinicians can focus on those patients who most need attention, rather than just the enormous flow of people who need to have blood pressure monitored on a regular basis and were previously going into GP surgeries.
The only thing I'd say on that, Matthew, though, is that, for the last 20 years, I've sat in meetings about, using more data in the health service, and, even more exotic things like, diagnostic support tools and things like that. And although to a technology person it all seems like a wonderful thing to do, it has taken longer than people thought it would. And there seems to be good progress being made now. But why has it taken, particularly in healthcare? What have been the barriers to getting that data used and the benefits of it?
So look, this is almost for me the absolutely central question. And in tech terms, as you will know better than anyone, what we're doing, what we're trying to achieve with data is a long way from cutting edge. It's what other sectors have done, in some cases years and years ago. So it's exactly the right question. Why has it taken so long in healthcare? And I think there are a series of reasons. I mean, number one, I think the entire system has got itself in a tangle over information governance, where it is right to put the highest value on preserving patient privacy and not undermining public trust that their very sensitive health data is being properly looked after. But this has, in practice, led to really complicated guidance from lots of different places, and a fear of sharing data, even when it is absolutely the right thing and legal and appropriate to do so. So one of the things we need to do is sort that out. I think there are wider issues. It's not about the technology. It's about attitudes and systems and incentives. And I think sorting it out will be about people, will be about making sure people have the confidence, the skills, making sure that the rules allow it, making sure that incentives align. So although it's on one level a tech question and a data question, solving it is much more about people and institutions and the systems we've got in place.
So, on a sort of similar related issue, we've had the general public understanding all about regulatory approval in a way that they probably never thought they would, as we've all watched with bated breath for the vaccines to be approved. And obviously, there's been some quite amazing work done in shortening the timescales there. One of the big debates in tech is obviously the effect of personalised medicine. And what we're likely to see is medicines which are incredibly personalised to, one of the 10,000 variants of lung cancer rather than lung cancer and that sort of thing. But that doesn't really fit with the traditional regulatory framework, which has generally been very much on a cohort basis. So do you think that we, perhaps even because of the realities of people following COVID and regulations, this is the right time to start to move to more sophisticated regulatory frameworks which move away from cohorts because of personalised medicine? Or do you think that actually we should stick with the old tried and tested methods? Where are you thinking on that sort of thing? And is it something that the public can be brought along with now, post-COVID?
So, look, I think, again, it's a really important question. And just before the pandemic, I convened all the chief executives of all the regulators and organizations involved in AI in healthcare. And we had 16 different chief executives around the table. And we agreed that actually we need to create a set of regulations and a regulatory framework that gives the public and clinicians confidence, but also which allows innovation to flourish confidently in precisely the ways that you're talking about. Because AI and data science and the use of data allow at least the possibility of a personalized approach to medicine, which has long been dreamt about, but been very difficult to get to. So I think absolutely we need to look at regulation, but actually I think even within the existing regulatory frameworks, if you could get data flowing safely but more effectively, if you were a doctor, an oncologist, for example, looking at a patient who had a sort of particular situation, and you could compare that patient against others with a similar risk profile, and look at what therapies work and what therapies don't work in real time, then even with the existing regulatory framework, we should be able to offer a much more personalized approach to medicine. And look, this is brought home to me by my wife's experience, who had breast cancer and was very well looked after by the NHS. But she went through chemotherapy, not because the oncologist knew that she needed that chemotherapy, but because there was a reasonable chance that if they gave that chemotherapy to, I don't know, a dozen people in her situation, then at least one or two of them would have a massive benefit from it. Now, it was absolutely worth it, absolutely the right thing to do. But if you could ensure that chemotherapy went only to those who would benefit from it, rather than, for example, a wider set of people, and you're then essentially playing the odds, the saving in terms of resource for the health service, in terms of the hardship of going through chemotherapy potentially unnecessarily, and the targeting of treatment much more precisely on those who need it, could across the health service have an enormous impact.
I think that's a great area. I actually worked with a Swiss company which does sequencing of tumours. So people talk about sequencing of people, there's actually sequencing of tumours, just so that you would know which chemotherapy drugs would actually affect that tumour. And I think that's technology we've seen trialled in the NHS recently, and I think that's a nice example. But what I wanted to do was perhaps give you a slightly unexpected twist on the data problem. So I get lots of pitches from startups, and I had one a couple of months ago from a Californian company, and the basic idea was that for some amount of money I could subscribe to a service whereby every day it would measure all sorts of things about me. And, it would on Wednesday tell me that suddenly my alanine transferase enzyme was looking a little low or whatever. And I was thinking about this and I thought, well, the problem is, if large numbers of the relatively well-off worried well are getting, being told that their aniline transferase level is rather low today, even though it may have no clinical significance, isn't there a danger that all of these people are going to turn up at the doctor's surgery and the NHS is going to get overwhelmed? And the thing that I started thinking about was, obviously we have a health service which at the moment uses clinical and scientific input to work out whether drugs are useful and work or whether tests are reliable. But we're in danger with this consumer sort of technology approach to healthcare that we're going to have lots of patients turning up because their iPhone has told them that their aniline transferase is low today. How is the NHS going to stop itself being swamped by the worried well if we end up with this sort of personalised consumer healthcare, which isn't really tied to the realities of clinical outcome?
So look, it's a brilliant question, but I think my view would be that problem is really a transitional problem. The old model was essentially your doctor is, you put yourself in the hands of your doctor or your clinical team, and you don't see your records and you accept passively the recommendations and the treatment prescribed for you. And it was very much an uneven relationship. And that model has held for a long time. I think that it's no longer sustainable, and there is an inexorable shift towards people having access to their own health records and data, towards people producing their own data with whatever devices they have and they're using. And as you say, people getting much more by way of signals of issues or potential issues around how they are and their own health. I think it would be a mistake, though, to respond to this by trying to calibrate how much information gets to people. Firstly, because I don't think you can. I think that ship has long sailed. But more importantly, because I don't think the answer to problems around people knowing something but not enough is to try and throttle information going to them. I think the reason I say it's transitional is because over time, I think we will create the tools and the knowledge that people need, so they know if they find out that their blood pressure has risen a bit overnight or whatever it is, they know when to be worried and when to consult a clinician and when to say, okay, well, look, this is something I'm going to note, but it's within the normal range of variance and I'm not going to run up to A&E about it. I think the best thing we can do is accelerate those tools and that understanding so that we give reassurance to the worried well, rather than try to throttle off information to them to stop them worrying.
Well, as a fully paid up member of the worried well, I shall look forward to the thing that tells me not to worry. Now, very short on time, but there's one area I'm passionate about hearing your views on, which is, obviously there's been a lot of debate about the interface of social care and healthcare. And I've experienced, some of the sort of difficulties in that. Unfortunately, my mother had Alzheimer's, and she lived at home for a long time for carer that would come in. And then she did something which is quite common in those patients, which is she got a urinary tract infection. And that has a strange effect in that there isn't much cognitive reserve, so she actually started hallucinating. And then the only option was an ambulance, and she ended up going into Chelsea and Westminster, where they were truly amazing staff. But she ended up blocking a bed for about 7 days. Really, it was a question of, if the urinary tract infection had been caught early, you could have avoided that situation. And ultimately, those kind of episodes lead to her not being able to have been at home. So, obviously, incredibly complex and difficult question, and one has to be very humble to the people that actually are out there on the front line doing this. But it does strike me that this is an area where perhaps a little use of technology could be accelerated. If we could have told that my mother was today suddenly acting slightly strangely, or indeed even by monitoring what was going on in the toilet, that she had a urinary tract infection, the whole system would have been able to handle her in a way that didn't involve ambulances and hospital beds. Is this a sweet spot? Is this a place where technology really can make a difference, or are we really missing the clinical realities of these situations?
I think it is, but it's not just about technology. And I'm sorry about your mother's experience, which sounds, really upsetting. But health and social care sit in quite sharp silos, and information does not flow effectively between them. And it's definitely something we're trying to address. And again, the technology is relatively the easy bit. It's the rules and the culture and the systems that allow this to happen. But we are trying to short circuit it. So one of the things we're doing this winter, and it's going on as we speak, is we're distributing 11,000 iPads to care homes around the country, which will allow for virtual consultations, virtual visits from the family, and over time allow for key bits of clinical information to be shared between health and care. And finding ways safely to share data across the healthcare divide, I think, will be absolutely key, both for health and for the NHS and for social care, because it's clearly unsustainable and deeply suboptimal to be in a situation where people are discharged to care homes without the care homes having access to essential information about their health, and people going from care homes into the NHS without the NHS being able to see essential information about their health before they were admitted. And it is solvable. It is a sweet spot. But the issue is, although we will use technology to solve it, the issue is not primarily technological.
Well, that makes a lot of sense. Now we are just about to run out of time, so I need 2 questions for you, quick answers. If you look at all of the things that are going on in technology across the whole spectrum, and not just in relation to health, but across everything, which applications of technology do you feel most optimistic about, and which ones are you most worried about?
So I am hugely optimistic in health around the use of AI to take out those tasks which can be automated, leaving clinicians to do the things where they add absolutely the most value: the edge cases, the caring, the human elements, the judgments, and so forth. So I think AI has the potential, done well, massively to improve healthcare. What am I most pessimistic about? Actually, it's not a technology, but it's about it's not a pessimism, but it's a concern that though the technology opens enormous possibilities, to realize those possibilities, we'll have to drive change in an extraordinarily complex, multi-dimensional system, which has so far shown itself to adopt change at a speed and with a consistency that isn't what we want. So my concern is, how do we drive change effectively across such a complicated system?
Well, Matthew, thank you very much. I'm mindful of letting you get back to that Gordian knot, which you're trying to untie. I am optimistic that we're going to see really quite some great steps forward in healthcare with technology. However, always humbled by the reality that, as you put it so eloquently, it's not really about the technology at the end of the day. It can aid, but it's very much about the people that are doing all those things. So with that, we've run out of time, which means it's Persian cuisine will be our next session. And I thank you for spending your time to share your thoughts with us. Thank you very much, Matthew. Thank you very much.
Pleasure. Really nice to speak to you, Mike.